The labeling on your prescription for testosterone is going to change. So this is something that almost nobody ever pays any attention to, is reading the labeling or the package inserts on your medications. But the medication labels and the medication inserts on testosterone are going to change. Some correct, some who knows, but the changes are going to be, one of the changes, it's going to say that there's an increased risk of high blood pressure from taking testosterone replacement therapy. If you understand what testosterone does, this makes sense because it can increase your output, your bone's output and your production of red blood cells, therefore increasing your blood volume, therefore increasing, and I'm dumbing this down a little bit, but therefore increasing your blood pressure. Now, what is coming off the label is that they have now said, okay, well, after a bunch of studies, we originally put it on the label after a while that it has an increased risk of heart attack and stroke. Testosterone therapy increases your risk of heart attack and stroke. And that was put as a warning label on testosterone replacement drugs. Now that portion is changing. The studies have been done and concluded that no, this is actually not occurring. The increased risk of heart attack and stroke is negligible. It doesn't appear that occurs at all after looking at it against placebos. So it does not appear, based on the new labeling, that testosterone replacement increases your risk of heart attack and stroke. Now, as with any medication, any drug, or any food for that matter, you can overdo anything, all right? So if you're going to overdo, or you're going to really, really push on testosterone and you're trying to get your testosterone levels through the roof and whatnot, and especially if you're going to do things like bodybuilding, the fact is you are going to increase your risk of heart attack because of the increased risk of stress on your heart. If you're pushing your muscles hard, heart grows, you get cardiomegaly, and that's going to increase your risk of heart attack. But for the average American, hormone replacement therapy, testosterone replacement therapy is not going to increase your risk of heart attack and stroke. Even the cardiovascular doctors have been relying on that label on the package insert to advise patients one way or another. They say, yes, you should take it, or no, you shouldn't. If you're seeing a cardiologist and the cardiologist is going by what's on the label, chances are the cardiologist is going to tell you, no, you should not be taking TRT. But now that may be changing. If you're a consumer out there and you have real low testosterone, when we do hormone work in our office, we're very much not trying to put somebody on a replacement. We're trying to handle the underlying reasons why the hormones might be low before we would ever resort to a replacement. However, some people do need a replacement, and you may find in the future that if you've been told it is a risk for you, that your doctor changes tune and says, no, it turns out it's not a risk, and now you're able to be on that medication without what he thought was a risk. Anyway, let me know your thoughts on this. I'm curious what you think regarding this hormone replacement and the changes on the label. I'm Dr. Dave Morris with Magnolia Medical Center here in Murfreesboro, Tennessee, and Functional Lab Hackers. Leave me some comments, hit the like button, and don't forget to share this.